Good morning, Dr. Patino here at the Cosmetic Surgery Cerritos. We're going to do micro power assisted. Power assisted means that this is like a toothbrush, but it's electric, right? See how it vibrates? So you don't have to be doing like the strong movements back and forth like you do with a regular brush, right? And we waited about an hour before we even start, right? I'm going deep here and pressing with my hands to go into the deeper layers that have already been tumescent with just the tumescent anesthesia, which is a modified technique, 1 milligram of epinephrine, and this particular one has only 250 milligrams of lidocaine per bag. But we waited about a good hour, and I want you to see how much out. Wow, that's some beautiful, beautiful aspirated. That's very important because if it's bloodless, that means that all this is going to go into her buttocks. You're going to see that this very same fat, without any treatment whatsoever, is going to go into her buttocks, pure fat like that, no blood, no oil, and as a result, then she's going to have much more fat graft retention, less complications like oil cysts and blowouts that may result as the body rejects that blood that's not supposed to be there, and it rejects that oil that's not supposed to be there. Continue to get bloodless aspirate. This is the fat that is going to go into her buttocks. This is incredible. If you see this yellow fat going into the buttocks, then you know you're going to have greater fat retention, because if it's red or pink or whatever, you know it's not your fat. There is some blood there that's obviously not going to be part of the volume. It's not going to be part of your augmentation. So whatever we put in there is going to stay because it's pure fat. We don't process this fat in any way other than we collect it in 500 ml of normal saline. But other than that, that said, we don't have a special processing system of fat. That usually takes time, at least an hour. So yes, I go slower here, but then I save the time because I don't have to process that fat in any way. So it's very, very easy. And you'll see it. You'll see how this is the yellow fat that's going to go into her body. Thank you. I'm covering a tattoo here. She's on her side, but look at that waist, huh? Look at that. See, we're down to, this is the pinch test, right? And we're down to nothing. And look at the beautiful waistline. Thank you. Let's do the same with the. All right, so we started on this other side, but notice how, we're going to give her a very nice shape like we did on the other side, a very nice waist. So we already did quite a bit here, but we're gonna do some more. Thank you.
This is at less than 2 centimeters right here, and This is the superficial gluteal fascia. This is the deep gluteal fascia. This line right here, that's Dr. Patino's cannula. He's going to wiggle it for us.
Yep, right there.
So, and then the skin's up here. So we're working in a very, very small space. You can see how if you didn't have the ultrasound, it'd be hard to say where you are, you know?
Yes, yeah, exactly. So that's your beautiful structure, and I'm going to go right in that area.
Perfect, yeah.
Can you get the tip of that cannula?
It's right here, so it's just underneath the superficial gluteal fascia, but
watch the bolus, watch what happens.
This area. So we see there's the gray, it's entering, this is the gray cloud. The deep gluteal fascia is already getting pushed down. It's already deeper than 2 centimeters, and superficial gluteal fascia is getting pushed up a little bit, but you can see that this line is dropping as fat enters the space.
Thank you. So we're doing ultrasound gluteal fat transfer, meaning that we can see exactly where we're putting the fat, so it doesn't go into the muscle where it could be dangerous. And look at the quality of that fat that's going in. What do you see, Wendy?
Oh, I see beautiful liquid gold here.
Awesome, thank you.
100.
Wow, so look at the tip of the cannula right there. There is some fat already in that space. But you can see how, you know, I'm going to go a little deeper and give it a little more. Let me see. This is all good fat in there, actually. There we go. So there we go. So that's the tip of the cannula right there. So you can only do it not only for safety, but also for cosmetic results. So you look at where you need to put some more fat, and there you go. So here we go. A little more fat going in there, you see? Incredible. Thank you.